So we're looking at the surface anatomy of the knee region. The good news is pretty straightforward, okay? There's 5 really easy structures, but then the bad news is there's one really tricky one, okay? So the first 5, absolutely dead easy. We're starting with the base of the patella. Now the base is actually at the top, it's the superior aspect, okay? It's called the base because it's flat, so you have to imagine that it's a triangle, but it's upside down. So the flat bit is still the base, even though it's on the superior aspect. So the base, pretty easy to find, it's at the top of the patella. The apex is the pointy bit at the bottom. Okay, so base, apex. Now, of course, travelling from the apex down to the tibial tuberosity, which is one of the other ones we've got to find, which hopefully is pretty prominent, pretty easy to find, is the patellar ligament, or patellar tendon if you prefer. And that one, again, it's pretty easy to find, and hopefully you'll be able to just get your thumb and forefinger either side of it and feel it. But if you're having any trouble at all, what can you do? Or what can you get the person you're palpating to do? Well, you could lift their foot off the floor. Sorry, is that what you said? Or yeah. So basically, you want them to do a bit of movement. So you want them to use their quadricep muscles to extend the leg at the knee. You probably don't want them to come right into full extension because then everything's a bit flat. But if they're somewhere around about here, not at 90 degree flexion, but a bit less than that, but they're holding their foot off the floor and they're using the muscles, that will make the patellar ligament or tendon go really tight, and hopefully then you'll have no trouble at all finding it really easily, and then get them to relax and make sure you can still get it. It is much thicker down the structures either side of it, the patellar retinaculate, so you should hopefully be able to find it. Okay, so we've got base, apex, patellar ligament, tibial tuberosity. Oh, and then the last 2, we'll use this model here to show them. So we're looking at the popliteal fossa. So we're at the back of the knee with someone in flexion. So someone just sitting on a chair with their knee flexed to 90 degrees. This shouldn't be too tricky. Come along and find the hamstring tendons again. And hopefully they're really easy. From last week they're really prominent, really skinny. Then you come down from them, and the quadriceps, the gastrocnemius and plantaris that you can feel here, they're similar, but they're not really skinny tendons. What they are is muscle tissue. But what you can do to find them, is put your fingers in towards the middle of the fossa with both hands, like I've got here, and then just move out medially and laterally like that. And what will happen is the muscle and tendon tissue of the gastroc and plantaris will kind of flick or roll under your fingertips, and you'll feel it because they're vertical kind of fibres of the muscle and tendon, and so you'll feel them as you move across like that. Now on a plastic model, of course, the muscle here is not going to move, but on a real live person, you will move it laterally a bit, and then as you keep rolling over it, it'll pop back, okay? And it shouldn't hurt, but the person will feel that sensation. I'll tell you, yeah, you're on it there. So find those, okay, the gastrocnemius and plantaris, and then what you want to do is palpate in the middle of the fossa, but you're going to have to palpate fairly deeply, okay? Because what you've got, superficially there'll be a nerve, and on some people it's really palpable. Which nerve is that running right down the middle? The tibial nerve, yeah. So on a lot of people you'll feel that. But don't forget there's fascia, there's quite thick connective tissue, and then there's a fat pad. So what you're doing is trying to push through all of that and get down to the bone. And with the person in flexion, if you just push directly towards the tibia, it should be the best way to go. And then what you're trying to feel for is what? A pulse. You're trying to feel the artery, so you're looking for a pulse. Now, on the first 3 people I palpated yesterday, it was just there like that. But then after that, it's been really, really hit and miss. On some people, it seems to be almost impossible to palpate. Do not get stressed. If you're following the instructions, if you find the gastrocnemius on both sides, you find the tibial nerve or not, it doesn't matter, and you palpate in the middle, and you're pushing towards the proximal tibia anteriorly, and you're holding the knee still at the front, and you're being careful and gentle, and if there's any pain, the person tells you and you stop. But if you're doing all those things, you're doing it right. What you're trying to find is a squishy structure with a pulse right against the bone. but it is difficult. So please don't get stressed if you don't find it quickly or you don't find it. Just keep trying. Try on different people. Try both limbs on the one person and then try someone else. And if there's in your group, if you find someone that it's really easy to find on, make sure everyone finds it on them so that you've felt it and you've experienced how it's actually going to feel. Okay? Is everyone okay with that? And that's it for the surface anatomy for this week. Just the one really tricky one. But keep going with it. Hopefully you'll get it.